A title screen appears. Annual Lessons Learned Webinar, July 31st, 2019. QIC-AG, National Quality Improvement Center for Adoption and Guardianship Support and Preservation, a program funded through a 5-year cooperative agreement with the Department of Health and Human Services, Administration for Children and Families, Children's Bureau in partnership with Spalding for Children, the University of Texas at Austin, the University of Wisconsin-Milwaukee, and the University of North Carolina at Chapel Hill.
Welcome everyone, and thank you for joining today's webinar. Our webinar is scheduled for approximately 75 minutes, and to eliminate background noise, all phone lines will be muted for the duration of the webinar. There will be opportunity for questions at the end of the presentation, and you may ask questions or submit comments by typing in the chat window, which is located in the lower left area of your screen. Click on the blue chat icon to enter your question, and when you're finished typing, click on the send button to submit your questions and comments. If you are joining the audio for the webinar using your computer speakers, please be sure your speakers are turned on and the volume is turned up. If you have trouble hearing the broadcast, you may alternatively call the toll-free number 1-866-519-2796 and provide the required participant passcode, which is 596115. This is the same number and passcode that was provided in your ReadyTalk confirmation and reminder emails. The PowerPoint handout for today's presentation was included as a downloadable file in your meeting reminder email, but if you did not receive the handout and would like a copy, please send a chat message with your email address and we will forward a copy after the webinar concludes. Today's webinar will be recorded and archived for later reference on the QIC-AG website, and we will send out email notifications when the recording is available. As always, we would appreciate your feedback, so at the conclusion of this event, please take a few minutes to share your thoughts with us by responding to the survey, which will display on your screen. I would now like to introduce June Dorn. June is a National Adoption Specialist with the Children's Bureau. Welcome, June.
Thank you very much, Ingrid. And I would like to just extend a warm welcome to everyone from the Children's Bureau this afternoon. Thank you for taking time out of your busy day to join this webinar, which we hope will be very useful to you as you consider how to further develop post-adoption and post-guardianship services in your jurisdiction. Again, I want to thank you for joining this webinar. This Quality Improvement Center for Adoption and Guardianship has been an important funding venture for us at the Children's Bureau, and we do look forward to hearing more about the lessons learned this afternoon. With that, I would like to turn this over to Leslie Cohen, the Project Director for the Quality Improvement Center with Spalding for Children. Leslie?
Thank you, June. Hi, welcome everybody to our final Lessons Learned webinar from our 5-year cooperative agreement with the Children's Bureau. We are very excited to have you join us. And it is called the QIC-AG Implementation Lessons Learned. I'll be joined today by Stephanie Hodge-Wolf, who's a site consultant on the project in Illinois, Wisconsin, Tennessee, and Texas. And we will also be joined by Don Danita Fleury-Simmons, who's a site consultant in New Jersey, as well as in the Winnebago tribe for Nebraska. We have a few learning objectives for today, and we hope that by participating, you will gain a basic understanding of the deliberate approach to implementation used by the QIC-AG, that you'll learn about the lessons learned themes that emerge during implementation, as well as site-specific examples to support those themes, and also gain an understanding of how these lessons, and perhaps most important, how these lessons are relevant to your work in the field. For those of you who are unfamiliar with the QIC-AG, it's a 5-year project working with 8 sites that implemented evidence-based interventions or developed and tested promising practices, which we hope that if proven effective, as demonstrated by our final evaluation reports, which should be accessible at the end of September or in October, we hope that if proven effective, they can be replicated or adapted in other child welfare jurisdictions. Effective interventions are expected to achieve long-term stable permanence in adoptive and guardianship homes for waiting children, as well as children and families after adoption or guardianship has been finalized. The project is a cooperative agreement with the Children's Bureau. I work for Spalding for Children, and we have evaluation partners in the University of Wisconsin-Milwaukee, University of Texas at Austin, and the University of North Carolina in Chapel Hill. From the beginning, the QIC-AG was really focused on quality implementation and evaluation. And to support this, all 8 sites followed a structured progression through the various phases of implementation science, informed by the National Implementation Research Network. Many of you probably know it as NERN, along with elements from a framework to design, test, spread, and sustain effective practice, which was developed by the Children's Bureau in 2014, which was to inform and design implementation and evaluation of interventions.
A process diagram that illustrates the steps to designing, testing, spreading, and sustaining effective practice. First, identify and explore, which includes identify the problem, understand the problem, construct theory of change, research solutions, and choose intervention. Second, develop and test. Third, compare and learn. Fourth, replicate and adapt. And fifth, apply and improve.
Used together, we created a structure that enables sites to first identify a problem that needs to be addressed, develop or choose an existing intervention designed to address the identified problem, thoughtfully develop a plan to guide the preparation for and delivery of the intervention, to modify or develop the infrastructure needed to support the delivery of the intervention within their systems, and provide the service to clients as intended, and ultimately build a body of evidence about the intervention's effectiveness. All in all, we anticipated that following a deliberate implementation process would minimize errors in execution that often impede the successful delivery of services to children and families. If you want to know more about implementation or check out implementation tools that can facilitate implementation in your site, we've provided you with a few links on this site and also provided a link to the design, test, and spread framework as well.
2 categories of links. First, implementation tools can be found at the websites https://QIC-AG.org/I as in India, M as in Mike, T as in Tango. https://capacity.childwelfare.gov/states/focus-areas/C as in Charlie, Q as in Quebec, I as in India, /change-implementation/series-at-a-glance. And https://N as in November, I as in India, R as in Romeo, N as in November, dot, F as in Foxtrot, P as in Papa, G as in Golf, dot, U as in Uniform, N as in November, C as in Charlie, .edu. Second, the framework can be found at www.A as in Alpha, C as in Charlie, F as in Foxtrot, dot, H as in Hotel, H as in Hotel, S as in Sierra, .gov/sites/default/files/C as in Charlie, B as in Bravo, /P as in Papa, I as in India, I as in India, _ T as in Tango, T as in Tango, A as in Alpha, P as in Papa, _ framework.pdf.
So we learned a lot about implementation lessons, and some I would say we learned more easily than others, but we learned so much that we really wanted to make sure that we were sharing all of those lessons with the broader child welfare community. So we asked each of our sites to develop a site-specific examples from their specific experiences. And you can access those papers on the QIC-AG website, QIC-AG.org, and you will also find that address on the last slide of this presentation. But when we looked collectively at all of the papers that were written, all of the lessons learned, we found that there were several themes that emerged, and that those themes had to do with lessons related to staffing, internal, external stakeholder engagement, training, coaching, and supervision, recruitment and retention, affordability, logistics, and scheduling. So now I'm going to turn the presentation over to Stephanie and Don Danita, who will share the lessons associated with those specific themes.
Thank you, Leslie. This is Steph. Hi, everyone. And we're going to start off talking about our first lesson, which has to do with staffing selection. And one of the things that we learned here was that it's important to use staff who have the knowledge, skills, characteristics, and abilities needed for the intervention approach to make sure that there's a good fit with the program. And so Dee's going to talk about an example in New Jersey, and then I'll follow up with something from Tennessee. Dee?
Good afternoon, everybody. So in New Jersey, the team created position descriptions and developed an interview process designed to capture the interviewee's strengths. Particularly, we were looking for strengths in adoption competence and the capacity for empathy. We were implementing a program called TENT, which is emotion coaching. And so it's really important that the folks that were going to be doing the coaching of the coaches had that capacity for empathy. We wanted to make sure that they also had an understanding of public adoption and of guardianship. We also made sure that there were some that were involved that had experience in private adoption. And we wanted to make sure that people understood sort of the work that goes into small group facilitation. The site made decisions early on to identify both public child welfare supervisors and private agency clinicians. Whenever possible, the two were paired as tent co-facilitators to leverage their expertise. It turned out to be a really exciting team. To watch people with two different expertise come together and share those two expertise in the room was sort of a beautiful thing. And I don't think it was an intended consequence. It was more of an unintended consequence that they learned a lot of mutual respect and collaboration for each other. The team evaluated the facilitators' work. We evaluated their personal style. We had some simple questions like hot or cold or driver or passenger, things like that that would allow us to kind of get a sense of who was very similar to one another and who was different from one another. And those things were then considered in the pairing of matching them together. The information was also used to make sure that we paired folks, or placed folks, geographically. And so that all the areas of the state were covered since we were doing a statewide implementation. Just like it's important for families not to have to drive too far, it was important for facilitators not to have to drive too far to be there for their presentations and do their work. So every region of the state was covered. Facilitators were also diverse in terms of ethnicity, experience, and language. We were able to do the final implementation actually in Spanish with a new curriculum that was developed. Stephanie?
Thanks, Dee. So unlike New Jersey, where staff had to be recruited, in Tennessee, they used existing staff to implement their intervention. And Tennessee's project is a partnership between the Department of Children's Services, the state agency, and Harmony Family Center, which is the organization that delivers post-adoption and guardianship services. And in Tennessee, they implemented the neurosequential model of therapeutics, often referred to as NMT, and this was developed by Dr. Bruce Perry. In the NMT assessment process, it's a fairly complex process to learn and apply. The training is a lengthy process. It requires the digestion of a significant amount of content. And the Tennessee team concluded that because the staff at Harmony had advanced degrees, they had experience with additional clinical training such as TBRI and TFCBT and ARC and SMART, these staff had demonstrated a skill set that was well matched to the NMT process, and so they were a good fit for implementing NMT. Ultimately, NMT was set up to succeed in Tennessee because it was equipped with well-qualified staff. And when new staff needed to be hired, Harmony looked for people with a passion for working with children affected by trauma, people who are flexible thinkers, and who had intellectual curiosity. They conducted a two-phase interview process and added questions to the process to better understand the applicant's ability to be flexible, work creatively, and to determine their knowledge of sensory motor interventions, all characteristics that support the NMT philosophy and approach. So as Leslie mentioned, for each of these lessons, we want to provide you with some information about how you might apply the lessons that we've learned in your own work. And so I'll talk about some of what you see on the slide and highlight some of these areas. When it comes to staffing, we encourage you to think through the selection process. You heard Dee and I talk just now about how New Jersey and Tennessee approach staff selection, and you might want to consider how your process helps or maybe doesn't help you to get the right fit between your intervention and the staff needed for successful implementation. Other considerations include workload to staff ratios. Keeping in mind the specifics of your intervention, have you thought through capacity issues such as how many families one staff person can reasonably serve, how that impacts the number of staff that you need? You may need to think about barriers that could exist to obtaining qualified staff. For example, what do you know about your system's resources when it comes to the pool of potential staff? And if the pool is limited, are there strategies that you can develop to mitigate this barrier? I know staff turnover is something that many of us have experience with, unfortunately so, and especially important to consider when implementing interventions that require time-intensive training or training that's costly. It's important to consider the extent to which your program can manage the cost in both time and money to ensure a staffing complement is available to offer the intervention despite the turnover that is typical for your organization or jurisdiction. Our next lesson has to do with staffing and compensation, and another component here is the importance of demonstrating respect for project staff through thoughtful consideration of their time, effort, and compensation. In Texas, the facilitation of Pathways to Permanence 2 sessions was assigned to the facilitators under the category of above and beyond their existing job duties, so sort of in that other duties as assigned category that we all have on our job descriptions. And the department allotted funding to provide merit pay for the Pathways facilitators. In addition, facilitators were provided with the option to stay overnight close to where their class was being held and provided per diem reimbursements when the classes were at greater distances from the staff's home base or home office. In Tennessee, as I mentioned, learning the NMT approach involves completing assignments, participating in learning group meetings, attending mentor calls with the NMT purveyor, all activities that were required, again, above and beyond the family counselor's regular job duties. In Tennessee's case, staff were permitted to bill for their time on these activities as an incentive to offset the impact of the overage of hours and the time that they were investing to complete the NMT certification requirements.
And in New Jersey, staff compensation was interesting because we actually had two different types of staff, as you'll recall. So half of the facilitators came from the private sector and were running tent groups on their own time outside of their work. And the other half were state employees. So for the half that were private sector people, they were compensated in money. We actually set aside an allocation for them, and they were paid for doing the whole 7-week tent implementation series. But for the state employees, it was a little bit more complicated because they were doing it sort of as another duty as assigned, but not during the regular clock hours of their work. And so in that case, the state decided to use compensatory time for them so that they would get compensatory time on the books for each hour that they spent in preparation and delivery of tents. and then they were able to take that time and use it accordingly when they wanted. One of the interesting things I think that we found in New Jersey, even though it was respectful to set things up that way and to make sure that people had access to the compensatory time, we found a lot of the workers were so excited by doing tent and by the information that they were receiving that they actually never billed for it. So that was kind of a happy coincidence that they chose not to bill for it, but I do think it speaks to their commitment to tent.
Okay,
so
what do these things mean for you all? And so when it comes to compensation, we want you to consider these points. So first, determine if you can incentivize staff in some way when they're taking on additional responsibilities that fall under this category of other duties as assigned. And second, if you can get creative in your approaches, if traditional forms of compensation are not an option, that's another really great thing to consider as well. The bottom line here is it always feels better when your hard work is recognized and when you're compensated in some way for the effort that you've made. Even a small incentive can help staff feel better about their involvement and does show them the value that you place in the investment that they're making in the work.
Stephanie or Dee?
I'm sorry, I was talking on mute. So the next lesson is to collaborate with internal and external stakeholders to strengthen the impact of an intervention or bring out system change I'm going to talk about two very different types of ways of doing that from the two examples of the sites that we have here. So in the Winnebago tribe of Nebraska, it was really important to understand the need to practice cultural humility. Conferring with their stakeholders was really more than just conferring. It was really getting an understanding of how they understood permanence, how they understood relationships with families and children, what they wanted to see happen in their community, and what they felt had not been happening to this point. So we really spent a lot of time working with various stakeholders throughout the community. We worked with families in the community to hear more about where they were having trust issues with their child welfare systems and how difficult that was when we heard from child welfare workers about how they felt distrusted in the community that they not only worked in but very much lived in. We had the Ho-Chunk Renaissance, which is committed to culture and language education and restoration for the Ho-Chunk tribe, to also share a lot of valuable insights about historical and traditional values and beliefs of the Winnebago or Ho-Chunk people. And we had elders that really informed everything to the naming of our project on out. So they really helped us to understand why adoption wasn't as viable an option in Indian country as it might be elsewhere. And they helped us to understand why belonging existed for children even when they were placed outside of their homes. And they helped us to understand the real impact of what it was to have a child from one clan to live in the home of another clan, and how you still had to value those original clan roots. So all of those things were necessary to ensure cultural congruence, and we could not have done it without their participation. Another big stakeholder in Winnebago was the legal system. There were several code changes that needed to be made to reflect permanency and the way that they were moving forward. And so we had to have the attorneys involved and the courts involved in making sure that those code changes happened so that families would have a more secure permanence than they were having before. So that's one way of using stakeholders. The other happened in New Jersey, and New Jersey developed very traditional teams, a stakeholder advisory team, a project management team, to work together to think about what needed to happen in their state. The first project management team had over 30 people in participation with lots of ideas and insight about what should be moving forward. And that included public and private sector folks. One of the big discussions, of course, was that we had not traditionally, as most states, reached out to post-adoptive families without them inquiring for something. And so one of the big discussions was, how do you begin to do that outreach? How do you begin to have that conversation with families that aren't expecting to hear from you? And so they were able to give us a lot of insight and information on what that should look like. They were also very instrumental. They kind of mooshed into one team over time, or morphed into one team, I guess is the right word. And what they were very instrumental in being able to review the curriculum that we were bringing in. We brought intent from Australia. There were some differences in who it had been tested with. We wanted to make sure that it was socially and culturally and linguistically appropriate for the people who were going to be using it and the families that we were going to be working with. And we really needed the input of the adoption provider community, both public and private, to inform those decisions. And so both of those ways, they really guided the project. They stayed involved on a monthly basis throughout the duration of the project. They are still involved in hearing updates and giving us information if we need to know how to move and how to proceed next. But we wanted it to be reflective of that community and that culture in New Jersey as well, and that was the best way to do that. So there are a few considerations for the field when you're engaging internal and external stakeholders. One, consider collaborating with respected community leaders and elders to ensure cultural congruence and credibility. As I said already, it really can't be done without that, and have it belong to the community. One of the sayings that Winnebago sort of developed along the process was that this is for us and by us. And that's the point where there was ownership in delivering the process, and so really critical and key. Consider who needs to be actively involved in the implementation, such as leaders who can champion the work. And many of us have been through recent turnovers and leadership staff, so it's very important to make sure that we're making them an active part of the implementation. Stakeholders with professional experience, and then families, of course, with lived experience that can really share, well, that sounds like it would work, but it would be really challenging or difficult for us. We'd rather have it done this way. So in all those ways, it's really important to engage internal and external stakeholders. There's one other stakeholder that I haven't mentioned because they were very external, and that was that there had not been a really strong relationship with private adoption agencies in New Jersey. And this work gave us the opportunity, or gave the SIM the opportunity, to engage them more fully in the process and actually become part of the consortium that does that work in New Jersey. So that should be a long-lasting relationship that was developed between the DCF and those adoption partners that would not have come about had it not been for our work.
Okay, so the next piece that we want to talk about has to do with training, coaching, and supervision. And when it comes to this topic, one of the lessons learned here is how important it is to solidify your practice model by supporting staff through training and ongoing coaching. And so if we take a look at what happened in Tennessee around this, again, as was mentioned, learning NMT and the related concepts is complex and it's cumbersome, and it takes a lot of hard work. The staff learn NMT content in monthly sort of segments or learning modules. And at the end of each month, they are participating in conference calls that are hosted by the purveyor, where they are expected to discuss the content that they've learned in that month's lesson, and where they get further digestion of the content. And these calls can be fairly intense, and they do require a significant amount of preparation time. What Tennessee added to the process to really help with this was that they created an internal study group, and the internal study group, just comprised of people from their agency who were going through the process, met monthly to talk about the concepts they were learning, talk about the content that they were trying to digest, And they were led, these internal study group calls were led by the Harmony training director, and they gave this really nice forum where the trainees could share their comments, they could raise questions, they could voice their concerns about the NMT curriculum prior to participating in that call at the end of the month with the purveyor. And so it ended up being a really nice combination of the study group and the open communication that was really helpful and worthwhile as part of the learning process. It enabled staff to talk about these really challenging concepts in a safe and sort of protected environment before kind of going outside of that and putting their toe in the water to talk about those concepts with a broader audience and with the purveyor.
And New Jersey had a sort of similar experience. But on the surface, New Jersey's training is very simple. So the training for TINT is a 2-day training that walks through a manual with pretty routinized activities and exercises. But what we realized is that most people were leaving that training having the basic information that they needed to do the groups, but certainly not the confidence to do the groups. And so New Jersey built in a couple of added layers to make sure that not only was there the original training, but that there was a lot of coaching and supervision to follow it. So I mentioned that this was an Australian model. We had to develop a way to meet with our purveyor, our trainer, at a time that she could meet and a time that each of the facilitators could meet across that 11-hour time span. So we became very good at doing electronic communication for all of our meetings. And the supervision meetings were held 4 times during the course of each TINT implementation. So at the beginning, to help folks anticipate what would happen in their first TINT and kind of get things structured. Again, after the second, so that they could think about how to proceed into the sort of heavier content of the material, a third time while they were in the midst of that material, and then a 4th time to talk about what it means to meaningfully close out and separate and bring TINT to an end, because by that time people were pretty emotionally engaged in TINT as well as physically engaged in coming to the meetings. So that was a huge supplement that's not required as part of the curriculum. I don't know if anybody else has ever done it that way, but it was something that New Jersey staff felt that they needed and that we wanted to make sure that we provided them with to ensure that the implementation was going to be done in a way that they felt secure doing it and in a way that really promised the greatest fidelity. In addition to that, we had an internal person who is our lead facilitator, and the lead facilitator would do weekly check-ins with staff throughout the process. So as a facilitator facilitated, she would call them, So she would call them and make sure that the facilitation had gone well, find out if they had any questions, if there were items that they hadn't felt comfortable doing or that they hadn't gotten to. She would also check in around the partnerships as we had paired facilitators together to make sure that those things were going well. That whole process really supported facilitators, we think, in a very unique way. There were only 2 people out of the pool of 40 facilitators that ever stopped facilitating over the course of the time that we were doing the intervention there. And they kept telling us how connected they were to the material. Finally, the third way that we worked with them in New Jersey was to do booster sessions. Those were very periodic, a couple of times a year, 3 times a year at the most. We gather the facilitators together and go over some of the core content in TINT and make sure that they were understanding it. We actually approached our TINT facilitator, our TINT trainer and purveyor, and asked her if she would be so kind as to develop something that we refer to as TINT Talks. They're sort of like TED Talks on TINT, so that the facilitators, after she's gone from the scenes, afterwards they would have access to her words and her saying her words to kind of renew in their minds how to do the training. And so she was gracious enough to do that for us, and we made a series of those videos that are accessible for trained TINT facilitators to watch and used to enhance their work. Winnebago was quite a different scenario. So in Winnebago, there were 2 facilitators, or coordinators as they're called, for the FGDM. So we did family group decision making there. And the 2 coordinators were very new to doing work with families, and especially to doing team and group work with families. So they needed to be undergirded with really intentional supportive training from the beginning. We wanted to make sure that they got a great training, and Kemp came in and provided a great training for them, but then that after that training they would have direct access to the Kemp purveyor on an ongoing basis. We also reached out to the Kemp purveyor and said, who do you know that's more geographically proximate, that's doing a good job of implementing FGDM to Fidelity? And we got a name from her, and we were able to make the connection to them and involve them as mentors to also help walk through, coach through, talk through all of the difficulties of setting up a real philosophy shift, not just a practice shift, in the way that they were going to engage families at Winnebago. Both of them, for a period of time, met with the tribe staff every week to go over cases and process, challenges that they were having and troubleshoot and brainstorm. As time went on and the tribe folks became more confident in their work, we were able to kind of pare that back a little bit, and so that they are now meeting every other week, sometimes once a month. But they know that whenever they have a need, they're able to outreach back and get the support that they need. And because the relationship's established so firmly, even after the QIC-AG involvement ends, both of those entities have agreed to continue to support the tribe as they evolve this work. So the considerations for the field for this are to determine the availability of supervision and coaching from the intervention purveyor or other entity. When we talk about the purveyor, we're talking about the person who created or is responsible for maintaining the curriculum with Fidelity. To consider the time and resources and investments that are needed, including the extent to which the system can accommodate having fewer staff available to see clients during the training, and the capacity building phase. To determine if ongoing training will be needed to reinforce or boost the initial training, and in both of the cases I gave that was needed. To establish the frequency of supervision and ensure that staff are meeting the expectations or delivering the models with fidelity. And then select a coaching model that helps staff explore their strengths and their weaknesses. All of these things were just really necessary to make sure that the implementation went well and felt good to the people who were delivering it. So the next is to develop a comprehensive recruitment and retention strategy to involve participants. Each site did this in a very different way, so I'm going to talk about just a couple of them. I'll go back to New Jersey again. But one of the things we need to talk about is that recruitment and retention are challenging. And for post-adoption and guardianship families, contact with the agency typically ended when legal permanence was achieved, other than the subsidy. And that might have been many years prior. And now, to complicate things a little bit more, subsidy payments are often made electronically. So to verify current addresses can be challenging and time-consuming. Recruitment has to require levels of strategy to make sure that you're actually getting through to the people that you're trying to reach. And then the messaging to families, particularly those that are being offered preventative services, really has to emphasize the benefits of engagement. All of the families are busy raising children. Any barriers to participation need to be removed. And if the intervention is scheduled in advance, then families might need to be reminded. So it was necessary to remind families that the meeting was going to occur and when things were going to get started. And they might need even calls or contact to remain engaged while they waited. Retaining families in the intervention lasting over several sessions could require flexibility. And it required a great deal of attention to building group cohesion. So one story we tell and laugh happened in the Winnebago tribe of Nebraska. And we call it the I Know Your Dog story. Because it really provides a good example of tenacious outreach. When the CFS staff, actually the coordinator for the intervention, started outreaching to families, there was one family on the list that they would go to the house and knock on the door and see the dog in the yard, and eventually the dog stopped barking at them, and they were finally able to get to that family. And you say, well, why do you have to do all of that? Well, part of the issue was that there were families, because it's a fairly rural community, that don't have phone lines or landlines, that didn't have, because this has changed actually over the course of the intervention, street addresses. Now they do. And so you were listening to one caseworker tell you where the family lived, and you were following the directions to that place. And then you were trying to reach them when they may or may not be home. Many caseworkers experience this even in very urban settings. And so it just required a lot of tenacity. The other really common experience in Winnebago was that folks were really far away. So there were cases where they needed to go miles, hours, to be able to do the initial outreach to engage a youth and to participate in family group decision making. So even though both of those things were known prior to starting the intervention, they weren't things that we had really spent a lot of time thinking through, and how much extra time, energy, work, fatigue even, that would cause the coordinator as they did that work. A different experience happened in New Jersey in terms of assertive outreach. It was a very traditional assertive outreach, but what was required was that multiple calls needed to be made to families to do the outreach. So because it was a prevention, we wanted to make sure that families understood that it was a prevention model. We understood that most of them, again, had not had contact with the state. We had a data team to create reports that let us know to the best of their ability where families were now, so addresses, and when possible, we were able to get email addresses. We hired a firm to provide us with additional information on addresses and email addresses, and a pool of folks made phone calls to each eligible family to find out if they were interested in participating. Calls were made in the morning and the afternoon and the evening and on the weekend until somebody got reached. It took an average of 2.5 calls per person before contact was made with the 50% of families with whom we ended up being able to actually contact. So not all families were ever reached. New Jersey registered the families that were willing to participate, documented their reasons for declining to participate if they declined to participate. This turned out to be a really important thing to have done because it really gave us a sense of not only how challenging it was to get folks to come, but perhaps why they wouldn't feel the need to come or why they felt like they were unable to come. And that will guide some of the future work with families in New Jersey. Our SIM in New Jersey also implemented what we call the turkey sandwich call. And the idea behind the turkey sandwich call was before the first night of tent, we were providing meals in all of the tent sessions. So before the first night of tent, we wanted to make sure that the family who had registered was actually going to come. We learned in usability that that doesn't always happen. And so we needed to make sure, to kind of find a way to strengthen the chances of knowing how many people would be in the room. And so we developed a bit of a social contract with a turkey sandwich. And we would call them and say, what type of sandwich would you like to have during the meeting? And if they responded with a type of sandwich, we were more assured that they were going to show up and be present for the meeting. Sorry, Stephanie.
Oh, that's fine, Dee, no problem. So I wanted to just share a bit about Illinois and what we learned there when it came to recruitment and retention in this issue was, and we did learn this the hard way, it was the importance of using language that appeals to the need that the families think that they have. And so in Illinois, it was our intention to reach families prior to a time that they might experience challenges. So we were trying to be proactive and preventative in our approach. But in our initial messages, we used wording like terrible teens and trauma. And so what our outreach staff started to recognize fairly quickly was that the more and more they talked with families, the more apparent it became that this wording and these messages were just too negative. And families seemed to more often opt out when staff would use words like trauma or even therapy. And so eventually what happened was we went back to our stakeholder advisory team, many of them adoptive parents who are members of the team, and we asked them for some help. And they really encouraged us to use and develop more positive messages that would resonate with our families who were doing fine, and that's who we were trying to reach. So an example message that we developed that was more positive was something like, in any family, stressful times can come up, especially during the teen years. Even when things are smooth, big and small life stressors can take you by surprise. We want to ensure that your family has the supports that can be helpful during your child's teen years. So what we tried to drop there was, sort of the negativity that can be felt around, the terrible teenage years and trauma and therapy. We were trying to move in a more positive direction. The outreach coordinators discovered that when the language used was more consistent with the family's sense of need, it became much easier to engage those parents and caregivers in conversations that created interest in the program. Because of the new language, the outreach coordinators' interactions with prospective families were much more positive, and this allowed the coordinators to gain more traction in converting those positive feelings into interest in the program and registration for the program.
And what we learned in Vermont was to not hesitate to ask. I think all of us going into this were a little concerned about how would families perceive us making a call to them when they hadn't reached out to us to see if they wanted a preventative outreach, a preventative intervention. And so what we learned was that they liked it. It was a good thing. Families were usually thankful and grateful that somebody cared enough about them to make that outreach and to ask. And if they had questions or concerns or things that they needed, they were able to raise those concerns at that time. So we did learn that while we thought it might be unwelcome or perceived as intrusive, the survey that they did in Vermont, I should stop for a second and say, so they did a very comprehensive survey across Vermont. I don't think we've talked about that yet. To talk to adoptive families, or to actually have them fill out a long form, to adoptive families to say, how is your experience in adoption being? What are the things that you've needed? What are the things that you've missed? And 100 other questions. And so one of the questions specifically asked about the outreach. And families said overwhelmingly that even if they didn't need anything, they appreciated the agency had reached out and had shown concern. This was a message that we heard across sites after reaching thousands of families. Less than a handful expressed anything other than gratitude. So some considerations from the field. Make the program pitch appealing to the target audience. And when it's prevention, that means that you're making it something that they can benefit from rather than something they need because there's a problem. Develop a recruitment strategy that's multifaceted. I mentioned the calls to New Jersey, but we also did emails and many other things that allowed us to reach families successfully. There was a hard mail letter, so on. Determine the best person or agency to contact the family. There was a lot of time spent with our stakeholder advisories about who should be on the letter, who the letter should come from that was being mailed out to families. Would they receive it better if it was coming from DCF or better if it was coming from our university partner at Rutgers? And so we had to kind of make those decisions throughout the process to see what worked for families. And how did they want to respond back? Did they need an opportunity to respond back in email, or did they need an opportunity to respond back to someone on the phone that they could ask more questions of? Provide incentives to make the participants feel valued. I think in every site there was some sort of a gift card or remuneration for families coming and participating. It's expensive sometimes for them to do. There's child care and transportation and other things that have to be taken into consideration. Ensure that the program meets the expectations of the participants and it does what it claims to do. So we're going to make sure that that you're on target about what it is that you're providing, that it's the thing that the community that you're working in has asked for, and that it actually does what it was intended to do.
All right, so our next area to talk about is affordability. And when it comes to considering if the intervention is affordable over time, it becomes critical to recognize the full cost, especially when there's extensive training or there's some sort of sustained purveyor involvement that's required as part of the process. So for Illinois, they implemented Target, and to become certified in Target, the clinicians not only attend training, but they also participate in individual and group coaching sessions after they complete their initial training. And the fees for the training and coaching sessions were fixed and somewhat predictable. In Illinois, we also used internal trainers and coaches, although at the end of the day, the cost to using those internal trainers and coaches ended up being about the same as it would have been had we used the purveyors, trainers and coaches. Another part of the certification requirements for Target are the submission of recorded sessions that are reviewed by the purveyor, and they review these to determine fidelity to the intervention. And so there are fees associated with uploading these videos to a secure location, storing them, and for the actual review of the sessions by the purveyor. And for Illinois, in our implementation, this became sort of unpredictable and was a challenge from a budget standpoint. So while we knew what the unit costs were to the process, we knew what the fees associated with uploading and storing and having the videos reviewed, what we didn't realize was that it wasn't quite as simple as that. And so in several cases, there were many more submissions of recordings that were needed for our facilitators to achieve certification. And so this became sort of an unintentional hidden cost over time and was very difficult for us to budget for and to manage over the longer term. In addition, there were other costs that we had to consider, like training manuals, actual tools like posters and wristbands and brochures that are used in the sessions. And we also had to purchase laptops, recording equipment like cameras and tripods so that we could actually accomplish the requirements of the fidelity system. So it does become really important to think about all of those costs, and sometimes that's more than the training cost or the initial coaching cost.
A last bullet point reads, consider using an intervention for which staff were trained.
So what does this mean in terms of considerations for you all when it comes to this affordability factor? So you need to ensure the program budget that you develop includes all of those initial and ongoing costs, and that may be administrative fees, costs for training. In Illinois, we really learned the importance of planning for contingencies when things took longer than anticipated or when we had staff turnover. We had originally planned to do one training for Target, and we had some early turnover in our staff, and it required us to rethink our plan. And so we needed to sort of reset our budget around that accordingly. You want to be aware at the outset of your project planning around all the costs related to staff, including the time that they need to prepare for sessions. So for staff using Target, for example, they needed to take more time than was typical to plan for their sessions because they were expected to adhere fairly strictly to the outline that's provided in the Target manual. So, sometimes we're talking about not just cost from a monetary perspective, but cost of time beyond just the initial training and coaching. We have to ensure that estimated costs are as realistic and accurate as possible. Again, this was a little bit challenging for us in Illinois because of the complexities around the requirements. Once again, you want to think about the impact of turnover on your costs, as I mentioned. And finally, you want to just be sure that you understand fully all of the fees to be paid to the purveyor beyond, again, that initial staff training. So it's really thinking about, what happens in in phase 2 and what happens once somebody achieves certification. You really want to understand all of those costs. Okay, so we're going to talk now about logistics and scheduling, and we have a couple of lessons here. And so another lesson learned the hard way was the importance of structuring schedules so that program staff were available at the same time families are available for services. So that seems a little bit like a no-brainer, but this is something that could actually be easily overlooked. And the fact is that there can be limits to the number of sessions that can be conducted by one person in a given week, especially when times that are popular with families like evenings or weekends often fall outside of our traditional or regular business hours. And in Illinois, the team actually found that Saturday appointments were pretty popular, and families needed to use Saturdays. Their kids were busy, they were busy, and so Saturdays were popular appointment times. And so if staff schedules were typically on Monday through Friday between the hours of 8 a.m. and 4 p.m., it wasn't always reasonable to think that we could accommodate more than a few evening or weekend appointments in a given week, right? So we're thinking about balancing staff needs as well. The other thing that Illinois found was important was to think about agency policy and its impact on the availability of their staff. Some of the agencies that were implementing Target weren't actually able to even allow their staff to work over weekends, even if their staff were willing to do that, because there were gaps in their liability insurance, or there weren't supervisors that were going to be available during those times. And so in some cases, this actually further reduced some of the options that families had to schedule during those weekend hours that were very popular. So when you're thinking about logistics and scheduling, considerations do include, as I mentioned, the impact of agency policy. I mentioned that a moment ago. Also, if it's likely that you'll need to offer the program outside of regular business hours, you've got to consider, again, the impact on staff, right? So particularly in an environment where we experience a lot of staff turnover, our staff resources become very precious to us, and we need to protect those. And so we've got to be thinking about what the impact is on our staff. So sometimes we know working outside traditional hours is going to be needed, so we want to make sure that we're getting staff and developing our programs in a way that are flexible and that we're willing to adapt to these variations in our family schedules. Okay, another element that we want to talk about in terms of logistics and is anticipating just the volume of logistical supports that you may need to successfully implement your intervention. In Texas, initially when we were planning our class schedules, we waited to set the schedule and find locations until after we had recruited participants, and there was some thinking behind that. But for many families, knowing the upfront information about where training sessions would be held and having that schedule far in advance actually made it much easier for them to make a commitment to the program and to sign up. And so ultimately, the Texas team changed the course, and we started to move to a schedule where we would set schedules and locations a year ahead of time. Setting the schedule out this far also gave us more time to conduct our outreach efforts, and so we could do things like mailing promotional materials. We could allow our community partners to really help us promote the intervention, and everyone sort of had the information that they needed to do that. In Texas, we also recognized that there was a struggle for many of our caregivers in terms of just finding appropriate child care. And for Texas, this had a sort of an interesting impact on finding our locations. From a budget standpoint, we really had hoped to initially had hoped to use free meeting space as much as possible, right? Funds are limited, and we were looking for ways to really leverage community support. And so finding free space was one way to do that. But free space was often very difficult to locate, particularly in Texas where we were providing on-site childcare. So we needed not only space for the actual class to take place, but we needed space for childcare to be conducted. And so we needed to have that as a part of our consideration. And although there were community organizations that would allow us to use the space at no cost, there was also this risk of being bumped, right? So if you're not solidifying or securing that space and the organization then needed it for something else, then you could be bumped. And we didn't want to risk doing that when we had set these schedules so far in advance. So ultimately, what we decided was that it just made more sense to pay for the space, and that actually really helped to streamline the entire process.
And New Jersey's experience was substantially similar. We programmed about 6 weeks out. 12 weeks out, we would start reaching out, and then by 6 weeks out, people knew where they were going, so that families could really plan the time and decide when was going to work best for them. We tried to make everything proximate to where families lived, and so things were sort of geocoded throughout the process, and so that we could see where the most families were. And then recruitment was targeted to 1 or 2, usually 2 counties at a time over the course of the state. And so each county was served eventually, but there was really a lot of work and thought done by our SIM to think about where those would be placed, how people would get to them, whether parking would be available. Every month when I would check in with the site implementation manager about sort of the biggest barrier, every month the biggest barrier was logistical planning. And so I think it's just important because I think it's one of those things that you think, yeah, I got this, and we look over it. But the truth is that it just required so much time and energy to make sure that the places were right and that the places were available for enough time. So for example, last year, New Jersey experienced 4 nor'easters. How do you plan for that? That meant that they needed to be able to reschedule and add scheduled spaces to be able to continue the TIN implementation over the 7-week period that it was being offered. So things like that just come up. Another big one was food. You know, we could use any food provider, but the food provider needed to be able to provide a receipt at the time of the meeting. Many of them failed to do that. There were challenges in getting the orders right for food. There were lots of things that happened that just required some attention to detail to whoever is kind of taking care of that piece of the process. And then as Stephanie mentioned, there's all kinds of appliances and setup equipment and things that need to accompany the training, and so that the coordinators and facilitators have the things that they need to do their work.
So some of the things to consider here when you're thinking about logistics, we talked about securing venues or space that are going to work with your program budget and match the target audience, and you heard Dee talk somewhat about that as well. I mentioned in Texas, certainly planning out the schedule well in advance of implementing really helped us to minimize the delays and to really maximize our registration, which was obviously important to us. You want to consider the complexity of the logistics, as Dee mentioned, particularly when you're rolling out multiple sessions in multiple venues. And as Dee said, you can easily underestimate this, but there are often quite a bit of staff resources that go into just making sure that those things are planned well, that they're monitored, and that everything goes off without a hitch. You want to build in your staff time into your logistical supports to make the program work and to be possible and to be delivered the way you intended. We found in Texas to provide options for childcare was really important. We wanted to eliminate what we felt was one of the most common participation barriers. And in Texas, when we actually asked families about the various supports that we provided to remove the barriers to attendance, most of them said that the provision of childcare was the most important of those supports to them. And in fact, many of the families that we asked said that without the childcare, they would not have been able to attend. And again, as I mentioned, we provided that on site in Texas. And then finally, you want to support families with features like food and transportation subsidies if you can do that to try to drive your registration and maintain and sustain your engagement over time. So sometimes the elements that we think of as extras are actually those that end up being pretty important to the delivery of your intervention, and they can make a big difference.
Thank you, Don, Danita, and Stephanie. I'd like to open the webinar up for questions. As Ingrid noted at the beginning of the webinar, questions can be answered via chat, which is located at the lower left corner of your screen.
Leslie, I see that.
Oh, go ahead.
I was going to say, I see that one question asked about whether or not there were evidence-based practices, and I just wanted to acknowledge that in both the cases of TINT and Target, we're talking about things that are evidence-based practices and family group decision-making.
Thank you. Do we have any other questions? Okay, well, as you can see, there are a lot of lessons that we've learned, so I hope that you're able to take the information we learned and sort of simplify the implementation process for yourself. Certainly, we hope that people learn, particularly from the lessons that we learned the hard way, so you can spare yourself some agony. And just a reminder, if you want to find out more information, we have site-specific papers located on our website. We have a question from Susan that says, I'm late to this process, wondering about data for each program, success of these interventions, in other words. So Susan, we are going to have evaluation reports coming out soon that will directly speak to your question. They should be located, we hope, on our website by the end of September or in October, and we'll do dissemination efforts to get that word out there. The best way to make sure you get that information is to go to our website and sign up for our listserv, and you'll be automatically notified when that happens. Sylvia asked, were trainings provided in Spanish? Do you want to take that?
Sure. TENT was not actually available in Spanish at the time that we decided to use that curriculum, but we were able to work with our purveyor and get permission to have it interpreted. So we hired an interpreter, had it interpreted in Spanish, and the first TIT delivery in Spanish ever, anywhere, is happening now or just finished happening in New Jersey. And that seems to have gone very, very well. We did have 3 bilingual facilitators, so we took that into consideration as we were hiring facilitators. We knew that that was the plan.
Great. When it comes, Nikki asks, when it comes to families asking for services that are not covered by insurances, what is the best way to approach discussions for problem solving and getting those services obtained and covered financially? Now, all of our sites were covered because of our particular arrangement with the Children's Bureau. We did have, I think, some initial conversations with sites about how that might be covered for sustainability purposes. Dee and Stephanie, I don't know if any of your sites came to some other conclusions about how to support these interventions.
Well, one thing, go ahead, Steph.
So I would say for the sites that I worked with, trying to keep in mind some of the examples. I mean, they were all thinking about, as they selected their interventions, what it was going to look like down the road when it came to sustaining and scaling those interventions. But I can't say that I recall any discussions or that our sites, any of the sites I worked with, landed in a place around where special funding kind of was needed. So for example, most found ways to incorporate that into their either existing contracts or into existing pools of funding so that they could continue the aspects of the interventions that they plan to continue, if that makes sense.
Yeah, and I think it really speaks to the importance of the focus that the Children's Bureau has on the child welfare system, providing a continuum of services to families that are accessible to them without having to use their insurance or, you know, their own dollars to cover those costs. And, you know, we can see some of that with the Family First legislation and opportunities for funding the continuum of post-permanency services, which leads me to Olivia's question about asking about evidence-based interventions, and specifically related to Family First and the Title IV-E clearinghouse. So we hope and we plan on submitting some of these interventions to the 4E clearinghouse for review. Some of our interventions meet that level of evidence. Some of ours don't, but what I will say is that regardless of the level of evidence, each of our interventions advanced the level of evidence that was available. So some may not yet reach the Title IV-E clearinghouse standards, but we also feel that some might be on their way, and ultimately down the road, if other sites are willing to implement and evaluate, they may ultimately make it there. Sylvia had a question. Were you able to measure the effectiveness of having, I'm not sure, interpreter third party involved in training, or were the individuals trained as presenters?
Yeah, so I think I just didn't clarify that very well, but I should clarify. So the actual curriculum and all of the parent materials were interpreted prior to implementation. So it wasn't live third-party interpretation. And then, or translated, I guess would be a better word, and then I wouldn't confuse you. And then we had bilingual facilitators to actually deliver that information in Spanish as you would any tint being delivered in English. So the only language that they heard during the implementation was Spanish, and all of the curriculum had been adjusted to reflect the Spanish language. So what we can tell is participation and engagement, and participation and engagement was wonderful. The families that came all stayed through to completion of the tent implementation. Because of the time constraints, we only have had a chance to do that just once, and so we can only be hopeful that they'll continue to have that success. New Jersey actually was able to get from the purveyor, sort of in exchange for doing the translation, a commitment to allow us to continue to use the curriculum for 5 years.
Great. And then there's a question about knowing which interventions are more likely to meet the evidence needs for clearinghouse approval. I don't yet. We are still working on that. Some of our interventions came to the table with more evidence behind them than others. So TINT, for example, from New Jersey is a really good example of that. I believe Pathways to Permanence 2, Steph, you can correct me if I'm wrong, has some evidence behind it, and we think we've got some good evidence to share with the clearinghouse. NMT doesn't have huge amount of sort of RCT randomized controlled trial evidence behind it, but we think we've got some there as well. So we're still working that out, and it'll be interesting to see what the clearinghouse ultimately does with that information. And then our last question is from Susan. Does the Children's Bureau have plans to possibly support organizations that would come downstream of these current 8 providers? So I think you're asking, is there going to be an opportunity to help other folks implement interventions? Susan, if you can type really fast, you can let me know if I've got that right. Sorry about that. We are unsure at this point, but certainly hope that there might be some opportunities to do that. But I want to mention that the Center for States has some great materials and does some great webinars and has the capacity to help states that want to implement interventions. So I would definitely check out their website because they have some great materials and some great opportunities. I want to thank everybody for participating today. Before you leave us, I just want to make another plea for filling out the evaluation form that Ingrid mentioned at the beginning of the presentation. It'll pop up once we pop off. If you don't give us feedback, we don't know, we don't know if we did a good job. We hope we did, but we also don't know how to make our work better. So if you can take a moment to do that, that would be awesome. And that is the conclusion of the webinar.
A final slide appears and reads, Leslie Cohen, email address, L as in Lima, C as in Charlie, O as in Oscar, H as in Hotel, E as in Echo, N as in November, at spalding.org. Site intervention profiles, lessons learned can be found at QIC-AG.org. Funded through the Department of Health and Human Services, Administration for Children and Families, Children's Bureau, grant number 90, C as in Charlie, O as in Oscar, 1122. The contents of this presentation does not necessarily reflect the views or policies of the funders, nor does mention of trade names, commercial products, or organizations imply endorsements by the U.S. Department of Health and Human Services. This information is in the public domain. Readers are encouraged to copy and share it, but please credit the QIC-AG. It's in Milwaukee.